Constant mucus is often linked to other causes that can be understood, and, in many cases, improved with simple daily habits. Knowing what's really behind it can help you breathe more easily, swallow with less discomfort, and enjoy a better night's sleep. In this video, I'll walk you through the 7 most common reasons mucus stays in the throat after age 60, along with practical steps that may help you clear it and keep it from coming back. Welcome. I'm Dr. Harrison Black. I've spent more than 25 years helping older adults understand how everyday health problems affect their quality of life. My goal on this channel is to share clear, evidence-based information that helps you make informed decisions about your health with confidence. Before we begin, I'd like to ask you a simple question. Have you noticed yourself clearing your throat more often lately? If so, you're certainly not alone, and today's discussion is for you. Before we talk about how to reduce mucus, it helps to understand why your body makes it in the first place. Mucus is not your enemy. Think of it as a thin, protective blanket that lines your throat and airways. Every day, it traps dust, germs, smoke, and other tiny particles before they can reach deeper into your lungs. It also keeps your throat moist, making it easier to swallow and speak. Your body produces mucus all the time, even when you feel perfectly healthy. The trouble often begins as we get older. With age, many people make less saliva, and the muscles that help move mucus down the throat may not work as smoothly as they once did. As a result, mucus can become thicker and stickier. Instead of clearing away easily, it lingers, making you feel like you need to clear your throat again and again. In many cases, the problem is not that your body is making too much mucus. The real issue is that the mucus has become thick and harder to clear. So if mucus isn't always the enemy, what causes it to become thick and annoying? One of the most common reasons for thick mucus is dehydration. As we grow older, our sense of thirst often becomes weaker, so many people drink less water without even noticing. Some common medicines, including certain water pills, antihistamines, and other medications, can also leave the body with less fluid. When that happens, your mucus loses moisture and becomes thick, sticky, and much harder to clear from your throat. A simple first step is to stay hydrated throughout the day instead of waiting until you feel thirsty. Try sipping small amounts of water every few hours. A warm drink, such as warm water or herbal tea, may also help loosen mucus and soothe your throat. If the air in your home is dry, especially while you sleep, using a humidifier can add moisture to the air and help keep your airways more comfortable. If you have heart failure or kidney disease, do not increase your fluid intake without speaking to your doctor first. In these conditions, the right amount of fluid is different for each person, and your healthcare provider can guide you safely. Another common cause of throat mucus is something called silent acid reflux. Unlike regular acid reflux, it often does not cause the burning feeling in the chest that many people know as heartburn. Because of this, many older adults have no idea it is happening. While you are lying down, stomach acid can travel up into the throat, especially during sleep. Even a small amount of acid can irritate the lining of the throat. In response, your body makes extra mucus to protect the irritated area. This can leave you waking up with a thick feeling in your throat, or clearing your throat throughout the day. There are a few simple steps that may help. Try not to eat within 3 hours of going to bed, so your stomach has more time to empty. Raising the head of your bed by a few inches can also make it harder for acid to move upward while you sleep. It may also help to reduce foods that commonly trigger reflux, such as spicy meals, fatty foods, chocolate, and caffeine. If these symptoms continue, become worse, or make swallowing difficult, it is important to see your doctor for a proper evaluation and treatment. The next 2 causes often work together. The first is dry indoor air. Air conditioners, fans, and dry weather, such as the harmattan season or winter in colder places, can pull moisture from your throat and nose. When the lining of your airways becomes dry, your body responds by making mucus that is thicker and stickier. Instead of protecting you quietly, it begins to cause constant throat clearing. The fourth cause is allergies. Tiny things like dust mites, pet dander, pollen, and other seasonal allergens can irritate your nose and throat. Your body reacts by making extra mucus to trap these unwanted particles. Some of that mucus then drains down the back of your throat, creating the feeling that something is always there. The good news is that small changes can make a real difference. A humidifier can add moisture back into dry air, while a saline nasal spray can help rinse away thick mucus and soothe irritated tissues. If allergies are a problem, using a HEPA air filter and keeping your bedroom clean by washing bedding regularly and reducing dust may help you breathe more comfortably, especially at night. Here is something that surprises many people. Sometimes the very medicines that help you stay healthy can also make throat mucus feel worse. Certain antihistamines can dry out the nose and throat. Some blood pressure medicines may cause a cough in certain people, leading to frequent throat clearing. Diuretics, often called water pills, remove extra fluid from the body, which can leave mucus thicker than normal. Another common cause is chronic sinus drainage, also known as postnasal drip. When your sinuses stay inflamed because of allergies, an infection, or long-term irritation, mucus can slowly drain down the back of your throat instead of flowing out through your nose. This thick mucus may make you feel as if something is always stuck, even when your throat is clear. If you think a medicine may be adding to the problem, do not stop taking it on your own. Instead, ask your doctor or pharmacist to review your medications. A simple saline nasal rinse may help wash away thick mucus and reduce irritation. Proper treatment can often reduce postnasal drip and bring lasting relief. The seventh and perhaps most overlooked cause is a natural change in the muscles you use to swallow. As we age, these muscles may become weaker, and the body often produces less saliva. Think of saliva as a gentle stream that helps wash mucus down the throat. When there is less of it, mucus can stay behind instead of clearing away as it should. Many people respond by clearing their throat over and over again. It may bring a few seconds of relief, but harsh throat clearing can irritate the throat even more. That irritation tells the body to make more mucus, creating a cycle that is hard to break. The good news is that this problem is often treatable. Try eating more slowly and taking small sips of water during meals to help move food and mucus more easily. Simple swallowing exercises, taught by a healthcare professional, can also strengthen these muscles over time. If swallowing becomes difficult or food often feels stuck, a speech-language therapist can assess your swallowing and recommend the right exercises. When you feel the urge to clear your throat, try a gentle swallow or a sip of water instead of a forceful cough whenever possible. Most cases of throat mucus are not dangerous, but there are times when your body may be telling you that something more serious is going on. That is why it is important to pay attention to certain warning signs instead of simply trying to treat the mucus at home. If you notice blood in your mucus, unexplained weight loss, or trouble swallowing, do not ignore these symptoms. The same is true if you develop a fever, your voice stays hoarse for more than a few weeks, or the mucus continues for several weeks without getting better. These signs may point to an infection, a swallowing disorder, or another condition that needs proper medical care. Your health history also matters. If you smoke now or have smoked for many years in the past, ongoing throat symptoms should always be checked by a healthcare professional. Remember, getting medical advice early does not mean something serious is wrong. It simply gives you the best chance to find the real cause and begin the right treatment. When symptoms do not improve or new warning signs appear, it is always safer to be evaluated rather than to wait and hope they go away on their own. Let's finish with a simple daily plan you can remember. First, drink enough fluids throughout the day to help keep mucus thin. Second, reduce silent acid reflux by avoiding late meals and sleeping with your head slightly raised if your doctor recommends it. Third, keep the air in your home from becoming too dry by using a humidifier when needed. Fourth, manage allergies and sinus drainage with simple steps like keeping your bedroom clean and using a saline rinse if it is right for you. Finally, if your symptoms continue or you think one of your medicines may be making the problem worse, speak with your doctor before making any changes. The most important thing to remember is this: most throat mucus after age 60 is not dangerous, but it should not be ignored either. Small daily changes can often make a meaningful difference, while symptoms that persist or become more serious deserve medical attention. If you found this video helpful, please subscribe for more evidence-based health information designed especially for adults over 50. This video is for general educational purposes only and is not a substitute for personalized medical advice. Always consult your healthcare provider before changing your medications, diet, or treatment plan.